Good evening, everyone. Thank you all for being here for what we believe will be a robust opportunity to talk about the significance of what's going on in our country. I want to thank the board of directors of this great institution for allowing us to be here today. A big shout out to Dillard University. I'd like to give a special acknowledgement to the president of this great university, Dr. Guillory. I'm not sure if she's here, but and I see Nick Harris in the back, who always answers the bell every time we call to this great institution. Nick, give Nick a big round of applause. To this great institution that stands for academic excellence, that has provided tutelage and education for our community for so long, and for being a beacon of hope and light in our community. We're grateful to be here. I want to thank all of you for being here today as we talk about issues affecting our communities, access to affordable and quality health care through Medicaid. As many of you know, Medicaid plays a crucial role in providing for millions of Louisianians, and it's essential that we continue to support and strengthen these programs. Republicans want to impose an $880 billion or more Medicaid cuts, which result in millions of Americans losing their health care. Now, to be clear, our counterparts will say Medicaid is not written in the resolution. Let's not be fooled. It doesn't have to be written in the resolution. If you tell me I've got to find $880 billion in cuts, it doesn't take a rocket scientist to say where that has to come from. We are all supportive of rooting out waste, fraud, and abuse. But trust me, $880 billion is not going to be waste, fraud, and abuse. It's just going to be abuse of the American people. And we're not going to stand for it. This will result in millions of Americans losing their health care, hospitals and nursing home closures, and much worse for those who don't and can't afford to lose it. This will put the elderly, the disabled, and our children at risk. Also, an unelected billionaire can be at the helm of delivering a permanent tax cut to the richest few in our country and to large corporations. We cannot, we will not sit back and let this happen. Tonight, we're fortunate to have three esteemed healthcare experts with us who will offer their insights and expertise on the current state of Medicaid in our state. I look forward to hearing from each of them, and I look forward to having you be able to ask me direct questions as well as our panelists. Together, we can ensure that Medicaid remains a strong safety net for our families all across our country. When we think about CHIP, 50% of the children in Louisiana benefit from Medicaid. When we think about our loved ones who are in assisted living facilities, Medicaid. We think about the birth of children with disabilities, individuals with disabilities, families caring for those with disabilities, Medicaid. This notion that somehow this is going to impact some and not others is a failed notion. Medicaid is a part of the fabric of our country, a country that should never have to wonder or guess about being able to have health care. Not in America. I don't care if you're Republican, Democrat, Independent, or other. It's just mean-spirited and ill thought to think that we're going to remove the safety net from so many Americans. Be it Medicaid, Medicare, or Social Security, rest assured that we are not going to be beaten. We may be outvoted on the House floor, but these kind of venues and opportunities to bring it to the people is where we're not going to be outvoiced. We're not going to sit back and let mere numbers determine how this works. We're going to protect our Constitution. We're going to protect our rule of law. And most importantly, we're going to protect the American people. So, ladies and gentlemen, it is my honor to bring up three incredible professionals who have literally spent their lives working in the area of healthcare, who are resident experts in the space of healthcare in general, and specifically their efforts to work for the people in Louisiana as it relates to Medicaid. But first, we'll introduce, and I'll ask as I introduce, stand up and join me on the stage, Dr. Chandra Williams. Dr. Chandra Williams is a respected physician and healthcare leader based in Louisiana, known for her exceptional contributions to healthcare, public health, and community advocacy, with a strong commitment to improving healthcare outcomes, particularly in underserved communities. Dr. Williams has established herself as a prominent figure in Louisiana's healthcare landscape. She is one that demonstrates and leads with her heart, with her expertise, and with her incredible training. You can hardly go to the internet and not see something that Inclusive Care is sponsoring throughout our community. It's amazing the energy she has and the commitment that she has. And when I asked her to be on this stage, she didn't blink. She said, when, where, I'll be there. Give Dr. Williams a big round of applause. Dr. Jennifer Avegno, you've seen her on television, you've seen her particularly showing her talent, her compassion, her love for our community during the COVID crisis. She was the face of sanity. She was the face of comfort during a very challenging time in our community. Dr. Avegno is a prominent physician and public health expert based in New Orleans, known for her leadership in addressing public health issues, particularly in times of crisis. As a highly respected physician, she has gained recognition for her tireless work in emergency medicine, infectious disease, and public safety. Dr. Avegno is best known for her role as the director of the City of New Orleans Health Department, where she has played a crucial role in lending public health initiatives aimed at improving health outcomes to the residents of New Orleans. She has overseen numerous programs focused on, let there be light, focused on combating, that was a quote, wasn't mine, combating chronic disease, improving access to health care, and addressing health disparities in underserved communities. Her leadership has been especially vital in responding to the COVID-19 pandemic, where she played an instrumental role in coordinating cities' response, managing testing and vaccination efforts, and providing guidance to both the public and all of our healthcare professionals. Give our two panelists a round of applause. I will, for the sake of time, I will also introduce our third panelist, who will be coming from another event, but was so eager to participate. She said, if you let me come late, I will absolutely be there, because she's so committed to, and she has a lot to say about Medicaid, and that is Dr. Rebecca Gee, who is the former Secretary of the Department of Health for the state of Louisiana. She now runs an organization called Nest Health. She's also Associate Professor of LSU School of Public Health and Medicine. Dr. Gee is a distinguished physician and public health expert with a strong track record of leadership in both healthcare policy and administration. She is widely recognized for her impactful work in public health, particularly in Louisiana, where she has played a pivotal role in shaping healthcare policies and reform initiatives. Dr. Gee served as the Secretary of Louisiana Department of Health under Governor John Bel Edwards, a position she held from 2016 to 2020. In this role, she was responsible for overseeing the state's healthcare system, including Medicaid expansion, which has provided healthcare access to hundreds of thousands of previously uninsured Louisianians. Under her leadership, Louisiana has made significant strides in addressing public health issues such as maternal and child health, behavioral health, and the opioid crisis. Dr. Gee's efforts in expanding Medicaid were especially notable as they contributed to reducing the state's uninsured rate and improving healthcare outcomes for our most vulnerable populations. Give them all a round of applause. I want to take a moment because it's always important for me to recognize and introduce my partners in justice. Not partners in crime, my partners in justice. So I'll ask that the elected officials that are present, please stand. I want you to see them. They've got multiple schedules and things to do, but they're making it a point to be here with us. In the rear we have, remain standing please. In the rear we have our mayor of West Wego, who's a dear friend, Bobby Billiot. Walking to the front now, we have our clerk of court and chief elections office, Darren Lombard. To my right, we have State Representative Delisha Boyd. In the stunning orange, we have Council Member Helena Moreno. We have Council Member Eugene Green, whose district we're graced to be in. And last but not least, we have our Constable of Second City Court, Edwin Shorty. I would ask now if our panelists will take, I've given a brief overview, but if you would just take a few moments to give a 2-minute remark on why we're here, why we're having to have this discussion about something as critical as Medicaid, and the notion that we can somehow unilaterally take to Medicaid with a chainsaw. So thank you for being here, and if you would leave with a couple of minutes, and then we'll get into the program.
Testing. Good evening, everyone. So this is no fun time. Wouldn't you agree? Despite all this beautiful weather as we are entering spring, despite the beautiful Super Bowl, Mardi Gras, Tardi Gras, and even St. Patty's Day, it's still no fun time. So I want to bring just a few points about my personal history and our background. I'm a resident or grew up in New Orleans, in Algiers, old Algiers, and I was born to a single mother. I was born to a 16-year-old single mother, and if it were not for programs like Medicaid and the safety net system, I was born in Charity Hospital. I was fortunately able to work with or be raised by the community, is what I like to say. And through being everyone putting their arms around me, that I was then able to become educated and acquire up to a doctoral terminal degree. And I think, Congressman, you called me a physician, if I did hear that correctly, but I'm a proud nurse. Yes. And so now to what we're doing, or what's the impact. So I happen to run Inclusive Care, which is a federally qualified health center. I'll say that again, it's a mouthful, federally qualified health center, which means essentially that we receive a little bit of funding to go a long way in order to serve the individuals who are often uninsured or who's considered to be vulnerable. And vulnerable could be transitional as it relates to socioeconomics. It's also vulnerable as it relates to disabilities. And so cultural and linguistic issues as well. And so community health centers have been established over 60 years. And through this federal legislation, we've been able to, across this nation, service 3.2 million individuals, many of whom rely on Medicaid for their access to care. So that's a pressing issue for us, of course, across the nation, but more poignantly, Louisiana, and then to the greater New Orleans area. So I stand here in the gap with my red lipstick on, recognizing that it is no small feat, and we're up against a battle. With your help, Congressman, we can actually overcome. But I must say, before I turn it over to my colleague, that community health center, for 60 years, the legislation has been, it's bipartisan. So it is important that we have the collective support of both Democrats and Republicans alike. And I'll just leave you with this figure. $118 billion is what our economic impact is. So community health centers are very important and stand to lose a whole lot in this fight with this $880 billion cut.
Well, good evening, everyone. Thank you for having me. It's always good to be with my good friend, Dr. Williams. And thank you, Congressman Carter. I think you asked why the administration would want to cut Medicaid, and I don't think there's a logical answer for that. We are an outlier among developed nations in that we do not have a robust, universal health care system. Health care is a human right. It is fundamentally. And Medicaid, for all its flaws, is as close as we have. I firmly believe, and I think Dr. Gee will echo this, that when Louisiana expanded Medicaid 9 years ago, that was one of the best things we have done for our citizens. And you can see the proof. Thousands and thousands and thousands of people have gotten screening mammograms, colonoscopies, pap smears that they never would have had, which has led to thousands of early detection of things like cancer, which has saved lives. We know, as you said, just, you know, I always bring my graphs and numbers if y'all know me. 2/3 of the births in this state are financed by Medicaid. That's our moms, that's our babies, that's all of our friends and neighbors. Half of our children. Say that again.
2/3. That's a supermajority.
2/3, yes, it is. A good supermajority, too. 75% of our nursing home beds are paid for with Medicaid.
Another supermajority.
Right.
And I want to emphasize that because when you think of the supermajority and you think about the amount of people in our state and what we look like, 75% catches every single part of every Louisianian.
And I think that's, you bring up a really good point. Medicaid is not an urban program. It's not a New Orleans program. About half of all children are on Medicaid. About half of our residents are covered by Medicaid. New Orleans, when you rank the parishes by Medicaid coverage, we're firmly in the middle. Where Medicaid coverage is the highest percentage of individuals in a parish, it's in the northeast corner along the Delta, it's in central Louisiana, it's in northwest near Speaker Johnson's district.
Say that again?
Near Speaker Johnson's district. It is also the reason why none of our 51, I think, rural hospitals have closed in the last 9 years. When you look at states around us that have not expanded Medicaid, and can you believe it, there are still a couple, they have seen rural hospitals close. I'm an ER doctor. I do my clinical work at UMC. We get transfers every day from small rural hospitals. They're the lifeblood of their parishes. If not for those hospitals, we know that folks in rural areas would suffer a great deal, and what's keeping them afloat? It's Medicaid. So it affects all of us. It's universal. It reduces inequities. So I don't know why we wouldn't want to keep it and expand it.
And I will inject a little bit of why. Because it's illogical after hearing what both of these healthcare professionals have shared with us. It's illogical. You can't make it make sense until you understand the underlying message. If our president has made, and we know he has, a commitment to making permanent these huge tax breaks for the richest rich, it has to come from somewhere. It has to come from somewhere. I happen to be fortunate enough to be the only member in the Louisiana delegation in the United States Congress to serve on the Energy and Commerce Committee. Energy and Commerce has oversight over everything healthcare, Medicaid, Medicare, you name it. If it's healthcare, we have oversight. Everything energy, if it has anything to do with energy, we have complete oversight. If there's anything to communications technology, we have complete oversight. But I'll go back and talk about healthcare. One of the directives that we've been given from the Committee of Energy and Commerce is to find $880 billion in eligible cuts in healthcare. And the argument that you hear in the news is that it's said that it's not said in the resolution at all. It doesn't mention Medicaid, doesn't mention Medicare, doesn't mention any of these things. But if you look at a pie chart of available dollars and you say cut $880 billion, it's quickly available to your vision that the only place you can do that is if you significantly cut into and reduce the resources for Medicaid recipients. It's not rocket science, but it's a fact. These numbers that you will hear tonight about the 2/3 and the 75 and the 50%, these are all empirical. These are not a part of any political agenda or discussions that are being pulled out of the air. These are empirical numbers. This is data with facts. And when we talk about where these people reside, it too is a part of a fact-based discussion. So when we bring this forward, the question again begs to be answered, as Dr. Vigno said, why? Well, there is no reason. Because I want to be very clear to all of you. Every one of us in Congress support the efforts to have a cleaning up and rooting out of waste, fraud, and abuse. Let them not hoodwink us with that argument. Let them not hoodwink you when they say it's not cuts. It's a reduction because of waste, fraud, and abuse. Not possible. I want you to be armed with the facts, and then you make your own decisions. This is, I hope, a group of individuals that are recognizing that the dangers that these unilateral cuts mean are very, very far-reaching. They know no race. They know no party. They know no gender. They know no socioeconomic strata, and they know no zip code. They will simply hurt Americans. And we are going to do everything in our power, albeit outvoted. Because we don't control the House, the Senate, or the presidency. But we're not going to abdicate our responsibility as members of Congress to continue to fight for you, bring these kind of forums to you, educate you on the facts, and then take back your commentary to our colleagues on the other side of the aisle and hope that justice, fairness, and fact-based discussions will change the paradigm. So with that, I want to start by just tossing out a few questions for our panelists, and then we'll hear from you and answer your questions. And I think we already talked about the partisan House budget reconciliation proposal that would look for cuts of $880 billion in cuts to programs. Can each of you share what these cuts would mean to the most vulnerable in Louisiana, including children, the elderly, and disabled?
Okay. So I'll just speak again specific to community health centers and then speak more specifically to 504, our community health centers in this area. If there were $880 billion in cuts, let the record reflect that as we are celebrating or commemorating the 20th year of Hurricane Katrina, I asked myself as a healthcare leader and a community leader, as if the landscape were any better 20 years ago than it is today. And to answer that question is it's not much better than it has been over 20 years. So I can only imagine that if there were cuts as abrasive and significant as it will be proposed or is being proposed, then I would imagine that it would just be a travesty. Jen, as a Dr. Avegno, as an emergency room physician, remembers the days when individuals would come in for common cold to the emergency room. So preventable issues that we can take care of in our neighborhood communities will land back into the doors of the emergency departments.
Can I ask, because I really want to pivot to the public. So I'm going to ask a couple of quick questions. If you guys give me a rapid answer, then I want to get to you, because I really want to devote the bulk of the time to hear from the individuals. But I do want these questions. What do you believe will happen with Louisiana hospitals if these cuts are passed, particularly our rural hospitals that we know shuttered after Bobby Jindal didn't accept Medicaid expansion and reopened when Governor John Bell accepted Medicaid
That's
expansion?
right. It is certain that several will close. That will increase the burden on other hospitals. You have hospitals like UMC, like New Orleans East, like several in Baton Rouge that take a disproportionate share of Medicaid patients. That will increase. Medicaid also pays for many of our training slots for doctors in training. If that gets cut, there's fewer doctors and providers to see patients coming to fewer hospitals. People will be sicker when they present. They will show up in the ER in distress, and there'll be more deaths.
Dr. Vegno, how would that roll over into the impacts on local and state budgets?
The federal government gives Louisiana more than $2 for every $1 Louisiana spends on Medicaid. So if that goes away, there is not enough money in state or local budgets to offset draconian cuts to Medicaid.
Can you share with us how Medicaid affects the ACA Medicaid expansion population from your operation, and how would that impact the population in Louisiana?
Yes, so the Affordable Care Act, I mean, I would imagine things like the marketplace exchange would likely go away as well. And so right now well, fortunately, through all of the great legislation and the Medicaid expansion, we've been able to drop our usually double-digit self-insured patients, meaning those individuals without any access to insurance. That would actually go to, I mean, we've been able to see single digits now. I mean, it's inevitable that we will be reverting back to an even probably more perversive issues where you see double digits, upwards of 20% can be projected as having being uninsured.
Is it also true that preventive medicine is much cheaper than curative medicine?
Absolutely.
Could you elaborate?
Yes, so, and I'll coin the phrase that one of our colleagues uses in the Medicare space. He calls it Medicare disadvantage. And the reason why it would be considered to be a disadvantage is because a lot of those programs, they target and market to our seniors, and they are supposed to provide $5 for this and $5 for that, and so it seems to be very attractive. But ladies and gentlemen, that's for the senior who is running at least 2 miles a day or sometimes several times a week, and that's just not the garden variety. So even though I use the example of Medicare, the Medicaid is not going to be any better at all.
Dr. Vigno, is it also fair to say that you've said it, but I want to say it again, that not only does this not in the long run save money, it's throwing good money away.
Right. Preventative care is much cheaper than to pay for the untreated consequences
And a person
of
that
disease.
shows up in the emergency room that has no insurance is still going to be cared for. Who's going to pay for
course.
that if there is no Medicaid?
Well, that's a question. I trained at Charity Hospital, and before the days of Medicaid expansion, it was not unusual to see women showing up with stage 4 breast cancer that was visible, for which the only treatment was either very expensive and likely not to be effective. I don't see that anymore. I used to ask my patients, how many of you have a primary care doctor? And before expansion, 80% would say, not me. After expansion, it's maybe 10% of the people I see. So,
Clearly, we have a system that's working.
right.
Why break it? With that, we've got a number of team where you guys kind of monitor where the questions are. I know we have people that have already filled out questions. We'll come to you with a mic. I will ask that everyone is respectful to ask their question quickly so we can answer it quickly and try to get as many people who want to be heard to be given an opportunity. So please, please, please bear with us and try to be succinct with your question, and we will likewise try to be succinct with our answer.
The first question is from Leslie Alley.
Leslie's over here.
You have my question. My card?
If the question's already been answered, just say amen.
I actually need the card because I have a lot of abbreviations in it. I'm trying to be very specific. Thanks. Okay, since PEPFAR was defunded, what about domestic HIV drug assistance programs like ADAP and LAHAP? Are they on the DOGE chopping block as well?
This is a very timely question. I just got a notification on my phone that there's going to be a big announcement about domestic HIV cuts. I don't know, we have not received any information as to what they are. We at the Health Department administer the Ryan White funding for 14 parishes, which supports many of those. So it's certain that something's going to be cut, but I don't know what, and it seems indiscriminate. So it's hard to say.
And if those are cut and that funding is cut, none of those folks can afford their meds anymore. Right.
And then we'll have a worsening epidemic when we were making progress.
Right. So deja vu. What? No.
Next question, thank you.
Reverend Jeff Connor.
Yes, my question is about Social Security. What can you and other Democratic representatives do to stop the mismanagement of the Social Security Administration by DOGE and SSA leaders appointed by Trump? And related, can you and others speak out to media and other public entities about the Musk and Trump's lies and untruths about dead people receiving benefits and other specious claims about Social Security being previously corrupt?
Yes, sir, that's a great question, and we are doing just that. These kind of opportunities give us a chance to speak out. I've been on every news station, locally and nationally, doing just as you suggested. We have a very robust social media presence where we tweet, we text, we on Instagram, we're giving letters to the editors, we're going to communities all over the state and country to dispel the lies. And yeah, I call them lies because they're lies. To spell out that this notion that it's not needed, it's so riddled with fraud that it should be collapsed. These are not widgets. These are people's lives. And this unelected billionaire who seems to think that he has found his new toy, that he's invested $200 million to have the ultimate place to play, the Oval Office. Well, Mr. Musk, this is not a game. These are people's lives. This is not the old school Etch-a-Sketch where you just rolled the wheels and you made all kind of goofy things and when it was all wrong. You shook it up and started over again, except you can't do this to people's lives. So we will continue to do just what you said, and as I've indicated, we don't have the votes to win in an outright vote. But we are going to use every procedural measure we can, as I refer to the 3 C's, in Congress, in the courts, and in the community. Thank you. Next.
Bain?
And if you didn't fill out a form, we'll double back and get to those who may have just come in late or didn't fill out a card. And someone's walking around with question cards if you'd like to fill them out.
So I'm asking about Medicaid in reference to autistic children and other people with disabilities. Medicaid currently covers ABA therapy for children with ASD and other disabilities. Research confirms the benefits of early intervention among these children. What will cuts do to the funding for this treatment? What can be done on a state level to provide continued access to these programs?
I'll just say, as the mom of a son with autism, who's friends with Dr. Williams' son, I feel this very deeply. A significant amount of care for those with intellectual disabilities, with neurodivergence, are paid for by Medicaid. I think those are voices that really need to be heard, because I think it's very hard for anyone to look those families in the eye and say that I don't want to cover you. I don't know what will happen. I want to be very honest with you. I don't know that the state would have enough or be able to cover all of the services, and they really are, in many cases, very good and robust services. I know that our FQHCs see a good number of individuals with disabilities. And so, my fear is they would get some care, the care that they got before, which was a patchwork and cost a lot of money, but they won't get the comprehensive care that they get now. Anything from your perspective?
Not much of an additional perspective, but I'll just say that when we're going to be faced with budgets that are going to be limited, I think there will be, envision a gumbo pot of individuals with needs, and now we're trying to figure out who is the most highest priority. So when you speak to autism, it may take the back seat to cardiovascular disease. It may take the back seat to someone with breast cancer. So that's the condition that we would be faced with, unfortunately.
Kelly Wagner?
Oh, okay, I got you.
You need the mic.
I think a couple of them have already been answered.
The first, okay. Okay, so I'm going to ask the hard question, because you're saying, the 3 C's, Congress, community, courts. Honestly, I'm not seeing much from Congress. Your hands are tied, and I acknowledge that. But our hands are tied too as a community. And so everybody keeps referring to 2026 elections. And that's where I'm really kind of scared, because I don't feel like we're going to make it, to be honest. So I want to know from you, the person who is closest to all of those people on the other side of the aisle, who can talk to Doge, do you believe that we are going to have a fair election system in 26? And do you think SAVE Act, I'm not sure how many people know, but SAVE Act will affect who can vote? Do you think that that's going to pass? So I'm just wondering, where is the community going to be able to hold out?
Yeah, and I don't think we have the luxury of waiting until 2026. We have to live in 2025. And so the notion that some have is just hold on until 2026 is not tenable. We are going to fight when we get to 2026, leading up to 2026, but we're going to live in 2025. And that means we're going to push back against everything that the DOGE mechanism wants to push against, which, by the way, is our democracy, our rule of law. You look every day, there is another executive order that's being presented that creates a further demise to America. And so you're right. We represent less than 50% of the United States Congress. Unfortunately, the way our system works, the majority rules. And so there are multiple things that we can do. We, as members of Congress who are in the minority, having less votes than those in the majority, will continue to try to work with, we only need 3. We need 3 Republicans who recognize how bat blank crazy this is. We need 3 Republicans who are willing to stand up and say, I am not going to follow you, Mr. President, because you are wrong. And we're going to work them. And when we can't get them, we're going to use every procedural tool that we have. And when that doesn't work, we're going to continue simultaneously as we have done, and we've been winning. If you've noted, the courts have been siding with us. But here's the constitutional crises that we have. This president is saying, I'm not listening to the courts. You've got every right to be afraid, but not to feel hopeless or not to feel defeated, because we're not going to lose, because we're not going to quit. And it's hard to be the person who never quits, and we're not going to quit. And we're going to stare in their face, and we're going to continue to appeal to the hearts, the minds, the consciousness of people who may not so far have found the courage to stand up in the face of a president who doesn't seem to care. That's why the community plays such an important role. We have to stay on their on their 1 yard line, to use a football phrase. You've got to not give our Republican counterparts a pass. You got to call them. You got to text them. You got to take it to social media. You got to remind them that they have a responsibility to represent all of America. I'm a Democrat, and I'm proud of it, but I represent Republicans too. And as they may be Republicans, they have a responsibility to also represent Democrats. Because above all, we are Americans. Next.
Michael Burnside.
And as I answer your questions, particularly the ones related to Congress, I want to be very honest with you. I'm never going to lie to you. As I answer the question, it may not be the answer that you like, but it will not be a lie. It may not be the answer that you like, but it's going to be exactly where we are. It's going to be fact-based. It's going to be hard for some, but you will leave here knowing that at least this member of Congress takes his job incredibly serious. And I will work it like my life depends on it, because all of our lives depend on it.
Nice segue, Congressman. Michael Burnside, question number 2. Dr. Jennifer Ovegno, our city health department leader, recently spoke before the city council. She spoke to the expansion of Medicaid and Medicare under past Governor John Bel Edwards. She spoke to the reduction in colon cancer due to the large increase in colonoscopies. Colonoscopies are early detection preventions are paid for by Medicare and Medicaid. This is Cancer Prevention Month. Have you had a colonoscopy, person? And do you recommend it to others, under the understanding that black men have the highest death rates of colon cancer?
Yes, I've had a colonoscopy. And I'm going to have another one. And I suggest everyone does, because it is one of those forms of cancer you don't have to die from. So I am the caucus chair for the Congressional Caucus of Men's Health, which is specifically charged with the task of preventive medicine, encouraging people to be checked. And I often use this analogy. When we drive our expensive cars, our Mercedes, our BMWs, our GMCs, our Cadillacs, and the check engine light comes on, we pull that sucker over quick. We find the first Firestone, Jiffy Lube, or whatever, because you don't want to blow a ride in that car. You don't want to mess up that engine. So when the check engine light comes on, you quickly get to a service station. Yet historically, we as individuals, we get warning signs too, and we ignore them. You know that ache, that pain, that shortness of breath? That's the engine light saying, check me out before I blow a gasket, before I'm on the side of the road. So preventive medicine is key. And I share your energy there, and we'll continue to push because, as I mentioned, as opposed to the two experts, preventive versus curative. Preventive is much more effective, much cheaper. Curative costs a lot more, and sometimes it's simply too late. Next.
Kevin Smith.
Hello, my name is Kevin.
Hey, Kevin.
I'm a student of International High School in New Orleans. I just turned 18. I was going to ask you a question about the LGBTQ community. However, I heard some things, so can I ask a different question?
Yes, sir.
So my question is, Democrats does have a little power in the Senate. That's called the filibuster. Republicans use it well underneath Joe Biden. Democrats failed to use it this last week. My question is, you say that Democrats does not have the power to block things, but we do in the Senate. We have a 47 seats. You need 60 to pass. How can we, since we don't have a Democrat senator in the Senate, hold our other Democrat senators from different states accountable in the state of Louisiana?
Kevin, you must have been reading my Twitter speed, because that's exactly what I've said. And that's what I alluded to a moment ago. That's a part of the third C, community. You don't have to just reach out to the senators in our state, because we know where they stand. Unfortunately, they are two Republicans that have sided 100% with President Trump and President Musk, and Mr. Musk. But we do also know that you're right. We have the ability to block cloture. We didn't do it this last time. And I was not shy about issuing my disgust and disdain for Leader Schumer, for leading the effort. I don't think we have the luxury to be shy. We don't have the luxury to not call people out when they're wrong. And I believe that that move hurt us more than we can ever say. We've got to use every tool in our arsenal, and yes, the filibuster is a tool, a power that the United States Senate has that Congress doesn't. That's our backstop, but we fail to use it. Check them. Go on Blue Sky tonight. Go on Instagram tonight. Shoot a text out and say, we're watching you, Mr. Schumer. We're watching you, Democratic senators. And oh, by the way, we're watching you too, Senator Thune and Republican senators, because you don't get a pass when it comes to messing over the American people. That was a very good question, Kevin.
Congressman, he had another question that I think it'd be good for you to speak to.
Okay.
Your original question.
My question about the LGBTQ community is that the LGBT community has been under attack by President Donald Trump. Shouldn't say his name, but it's true. My question is, what are you doing to protect the LGBTQ community as well?
I have spent my entire career, from the earliest parts of my elective life as a much younger member of the Louisiana House of Representatives, authoring legislation to create fairness and equality for all, specifically targeted to the LGBT community. I have carried that mantra through my entire career, whether it was on the New Orleans City Council where we passed domestic partnerships, or where we authored legislation in the state Senate that mirrored what I had done some 30 years prior in the House. And here we are in 2025, not only not going forward, but under this president going backwards. We will continue to fight. We'll continue to sponsor legislation. We'll continue. When I leave here, I'll be attending an Equality Pact discussion on just what you talked about, is how can we protect all of our affected communities from this hateful barrage of cuts and ill policies.
Troy Moon.
I'm going to take the question back to Medicaid real quick. So this is kind of a nuanced question.
Give him the mic anyway, please.
This is kind of a nuanced question. First, to try and understand Medicaid. So every time I hear about Medicaid cuts, it seems to be in the context of expansions through the ACA. And I'm wondering if that is really the only portion of it that's under attack, or if Medicaid that may come from a federal program such as SSI also under threat, or is that a different pool? And then before you answer that, I might just kind of go back to one of the comments made earlier. You mentioned that we only need 3 Republican senators. Senator Cassidy in this state is a physician and seems as somebody that we should be able to collectively shame based on his oath as a physician, and I would encourage us to focus on him.
I did that.
So I'll try to tackle your question of where are the cuts coming in. To my reading of it, and Congressman Carter, correct me if I'm wrong, it's been very vague, right? But I will say over the years, because this isn't the first time that Medicaid has been threatened by this president or even others, there have been a couple of themes of what might happen, and those themes seem to have reemerged. And you know, they might sound good. We all want to have good control of our finances, right? But they're not. One of them is, well, we're just going to cap the amount of money that we spend for everybody. So if you're on Medicaid, you only get X amount, and when it's gone, it's gone. That's okay if you're healthy, don't get in a car accident, don't have a difficult childbirth, don't have a child with a disability, don't get cancer. They don't really work, right? You can see how quickly that falls apart. Some of them say, well, we'll just leave it up to the states. We will stop, we won't give from the federal level the amount of match that we're giving, and the states, if they want to, can make it up. Again, that's a patchwork system, and I don't know that our state would cover the 90% that the federal government gives. And then the one that gets talked about a lot is work requirements. And that sounds good, right? That sort of feeds into some narratives that we might have. But the majority of people who are on Medicaid, who are adults, already work, right? These are our restaurant workers, there are Uber drivers, there are sometimes teachers, and sometimes medical professionals who just don't quite make enough or aren't eligible for insurance through their job. Those that don't work on Medicaid generally can't because they have disabilities or other conditions that prevent them from doing that.
Like caring for a child that may be severely disabled.
Exactly. And we know through other states that have attempted work requirements is they also don't work, and all they serve to do is block access and create barriers. So we don't exactly know unless you know what they mean by let's cut it. But these, if someone says, well, it won't be so bad, people will work. You know, it's great if the community can be educated on why that doesn't really work.
Well, and I'll tell you, there's been no specific point to the cut because they don't want to use the word cut, because they say reduction, because it is all allegedly going to come from waste, fraud, and abuse. If that premise were correct, that would suggest that the entire agency and every one of you who currently utilize Medicaid are fraudsters. That's the premise.
Are there different pools, though? Is there a federal pool for Medicaid for like SSI and the state Medicaid that's with the ACA? And
It all funnels from the federal government. It all funnels from the federal government.
There's 5 different types of Medicaid. There's Medicaid for people who are low income. There's Medicaid for seniors. It's Medicare, Medicaid, called Medicare.
Could you identify yourself?
Yeah. Hi, my name's Louisa Lickman. I'm also a social worker who background is geriatric social work. And I talk with my hands, and it's easier to do with my hands. There's 5 types of Medicaid. Medicaid is for people who are low income. Then there's Medicare for people who are either 62 or they have disability. There's 5 types of Medicaid. There's Medicaid for people who are children, Medicaid for pregnant women. There's Medicaid for seniors. It's called Medicare Savings Plan. And they have not released the data as of 2 weeks ago, and it's typically released now, and it's income-based. And I have a client who thought he was divorced. He's not divorced, and the state is doing it. So there's going to be a massive drop of people right now who are losing their Medicaid, who are seniors. If you are a senior, reapply for Medicaid. Do it in paper. Do not do it online. Do not do it over the phone. Do it in paper. That's the only way it gets through. Then there is, I'll go back to the ones with the seniors in a second. Then there's Medicaid for people who are HIV/AIDS, and then there's people who are low income, who meet the threshold. With the seniors, that's my background, there's 3 levels of Medicaid. This is the stupidest plan. It's called the Take Charge Plan, and it just covers birth control. I've had 80-year-olds who just got birth control. What the fuck, you know? I know we have a high prevalence of people who have HIV/AIDS in Baton Rouge and seniors, but that's not what they need. So there's 3 different levels, and it's based on income. And I hope that clarifies.
That's very helpful. Thank you. And they're all.
But if you do apply for Medicaid, let me stress this. Do not do it telephone. Do not do the paper copy. Include copies of your income. Include all the stuff that they need it. Mail it and fax it, or you'll get screwed.
Thank you.
Jerry Conrad.
And to further, just to cap on our fourth panelist who impromptu joined us. Thank you very much.
Welcome. I just feel like
No, we appreciate you. Thank you. And that's why we're here, and it's all federal dollars. So when you start cutting that, the notion that it'll get picked up somewhere else, it's not so. Ladies and gentlemen, we've been joined. We've already given you a glowing introduction and an applause in your absence, but I'll ask you to once again join me in applause for Dr. Rebecca Yee. Doctor, what we've done is we've gone through a series of questions, and now we're in the question-answer portion from the audience. But if you would indulge me, I will take a break in the action of our Q&A and pick right back up after giving Dr. Gee an opportunity to give an opening statement. But let me begin by thanking you and saying what I said before you got here of what a tireless worker you are and a committed soldier in the battle of providing effective health care to people in Louisiana specifically, but all over the world in general. I had the pleasure of working with Dr. Gee when she was the Secretary of the Department of Health and Hospitals for the state of Louisiana when I served in the state Senate. She was a dynamo in that role. She's a dynamo in her current role, and I thank you for being here.
Well, Congressman, I'm proud to be your constituent, and thank you for having this event. Medicaid is fundamentally the pillar of our society because, as Secretary of Health, you helped us expand Medicaid. We did that. Now 600,000 individuals in Louisiana have coverage. I'm an OBGYN. My background, I'm a mother of 5. I'm also adopted, so I was born, I now know I was kind of a lucky gal, but I was born, could have had a much different life, and I've always been an advocate for health equity, which means to me that every child, every mother, every individual in society has a chance of thriving and joy and of human rights and a life that's worthy of living. And a big part of that is health care. As a physician, I can tell you, having needed it myself, that we shouldn't live in the richest country on earth. We shouldn't live in a society where people are denied health care. Or as Martin Luther King said, there is, of all of the inequities, the worst is the denial of health care, right? Because it's just so clear that a human being's suffering or a human being's cancer or a child suffering or a child's cancer is worthy of care in a society where we can afford to do so. So I'll just say one thing. So as Secretary of Health, we had a really successful program. I see Jeannie here who helped me, Jeannie Donovan, so applause for her. She was one of our policy leads, and so many people in government are heroes. The politicians who come and go, and no offense, I was kind of one of those political appointees, but the people that work day in, day out and get told by predominantly the Republicans that they're not working hard enough, they're not doing enough, but they do so anyway because they care about the people of this state. They're real heroes. So I'll just say what am I doing now, and this is what's relevant to today, is I started a company after being Secretary of Health that takes care of mothers and children on Medicaid. We, as of last week, have 28,000 mothers and kids in New Orleans, Baton Rouge, in Phoenix, and in Mojave County, which is northwest Arizona. And what we do is we find moms and kids who can't get care and go take care of them at home. It's called Nest Health. But one of the things I just want to focus on is, did we go over this already, but what percentage of children in America have Medicaid? Have we talked about that?
Yeah, please.
1 in 2, right? What percentage of mothers in America, women, have Medicaid? It's 1 in 5, right? So if we get rid of Medicaid, right, it will pull the rug out from under our mothers, our children, our families, right? And I'll just say, as the CEO of my company, which is caring for Medicaid, I'm having a hard time raising money right now. Why? Because people say, well, what's Elon Musk going to do tomorrow? What's Trump going to do tomorrow? They have not just taken a scalpel, but they've taken a hatchet to this thing.
I think he calls it a chainsaw.
So, anywho, I am grateful to be here. Medicaid, healthcare is a human right. I'm proud to be with these two ladies who have fought for that. I'm proud to be with you. And thank you for being here. Your votes matter. Medicaid matters. And thank you for giving me a few minutes to talk.
Thank you very much. A round of applause for Dr. Gee. And so now, Dr. Gee, we will go back to the audience and they'll ask questions, and either or all of you may answer. If it's directed to me, I'll answer, and then we'll maybe jointly if there's further clarification. Next.
Troy, my name is Jerry Conrad.
Hey, Jerry.
My passion is with the kids in my community. We've used a lot of percentages we're throwing around, but 75% of our children in my community are from low-income families. Now, with the Department of Education going away and so supposedly being shifted to the states, how does that affect our kids? We don't get any help from the state now. The governor does not care about our children. We get no money for teachers' raises, for after-school care, or for tutoring. So there's no support now. So what does the future look like for them? And then there's a follow-up question along the same lines. Since DEI has been trashed and gone away, what does that look like in our future going forward? There was I don't know if you saw it, but on 60 Minutes, there was a heart-wrenching story about the young musicians that were going to perform, but couldn't because DEI refused to let them perform with the military band. So my concern is the kids have been left behind already. How much worse can it get?
Jerry, I never like answering that question, how much worse can it get, because it always tends to get worse, particularly in this type of atmosphere. It's bad. And the answer to your question is it is unconscionable what will happen because, as you noted, this woeful, neglectful ignoring of necessities for individuals is what they believe. And as you've just mentioned, if the federal government doesn't provide for these issues, state by state, there will be people that will go unserved. That's why the federal government's role has been superior, to provide for the states and to override in the cases where we've had governors and or legislators that wanted to ignore certain parts of our community. Not in America, man. We can't afford to have people discriminated against, isolated, and left to die. Unfortunately, you said a mouthful. That's why we're here, because we aren't going to let them. We are not going to let the fact that we don't have enough votes be enough for us to sit in our corner and wait until 2026. No, sir. We're going to fight today. We're going to fight every day. We're going to push back, and we're going to continue to tell our story and allow people like you and you and you and you to tell your story and put pressure on those who want to ignore your story. Do you know that my Republican counterparts have been told, don't have any more town hall meetings? Because they don't want to hear from you. You cannot govern in a vacuum. From my early beginnings as a student of government, I learned that government serves best when it listens to the people that it represents. And if you ignore the people that you represent, you fail to govern, and you should be voted out. Short question, short answer. Brother, we're in a battle. We're in a battle. And I wish I can give you an answer that will satisfy the questions. But as I said earlier, I'm not going to lie to you. I'm going to tell you the truth. I'm going to let you see our limitations, and I'm going to continue to enlist you to be a part of the solution. Don't give them a pass. Get on the telephone. Go home and tweet. Blue Sky, Instagram, call, write, visit. Tell them you expect them to do the right thing, to not ignore the rights and civil liberties of the American people. Go to his office. Go to his office. Be respectful. Be peaceful. But be determined.
Congressman, as we run a little bit shorter on time, we have some questions that overlap from groups that the constituents would like to hear from.
And then I also want to, as I committed, if there are individuals that didn't get a chance to get a card, if there are questions that have already been answered, then we're going to kind of skip over. But if there's something different that hadn't been answered of me or any of our panelists, by all means, we'll try our best to get an answer. What you got?
So the first of those is obviously the war in Gaza has begun again last night. And I think some of the constituents would like to hear from you on that resumption of hostilities.
And I will tell you that for those of you who can't see, there's a sign that says "Stop the Genocide of Palestine," and the other side of it says "Free Mohammed Khalil." And I will tell you, the atrocities happening in the Middle East are unconscionable. They're painful to watch. The bloodshed on both sides of the equation has been horrible. We have a president who said, in addition to, on day one, he would bring the price of eggs down. He hadn't done that. He said that he would bring grocery prices down. He hadn't done that. He said that the war in Ukraine would be over. He hadn't done that. And he said that the war and that there would be a peaceful settlement in the Middle East, and that hadn't happened either. In fact, each of those cases have gotten worse. And as it relates to Mr. Mohammed, Mr. Khalil, rather, you will see that I was very vocal, and I posted on social media as well as writing a letter suggesting that this is America. and freedom of speech is important, and it's unconscionable to think that a person, however, you may not agree with what a person says. You may not like what they said, but in America, we hold firm to the ability to stand behind the First Amendment and our freedom of speech. And in America, a person should not be arrested because you didn't like what they said. And so, as we know, we're here to talk about Medicaid. I am not going to shy away from talking about tough issues and issues that require that the American people demand a two-state solution, a peaceful resolution to the conflict that's happening in Gaza, to make sure that people are treated with civility and peace, and that the violence is ended. Yes, sure.
So I went to Cassidy's office, and I know I spoke with the person there who's part of his staff, and I was very pleased with things that he said when he was grilling Kennedy for the position, but it only ultimately mattered how he voted.
That's exactly.
And he voted to let him go through. He voted to let him go through on both committees that he served on, and then also on the floor. For you and your role in the genocide in Palestine, you have said statements that you want a ceasefire, but you have voted for money for weapons for Israel. Can you help us understand
Sure, I can.
how you can do that?
Yes.
And still say that you want what's best for the people of Gaza?
I can say that very easily, ma'am. Thank you for your question. Yes, I do want what's best for the people of Gaza. I want what's best for peace. But I also recognize that Israel is a strategic partner of the American people. And I will say this in any room, everywhere I am, I'll never double speak, that my support of Israel to fight against terrorists with Hezbollah and the Houthis is to support the Iron Dome, which protects the people in Israel. Yes, I voted for it, and I'll vote for it again, because I believe it's the right thing to do. That does not in any way take away from my disdain for any attempt to have ethnic cleansing or to have genocide. I have been very clear. But will I always support peace? Yes, I will. You may not like every aspect of it, ma'am, but I promise you, my position is very clear, and I've been very, very public. I believe in a two-state solution. I believe that people have a right to live and to live in their homeland, free of threat, free of harm. I also feel the same way when Hezbollah or Hamas shoots missiles to Israel to harm innocent Israelis. It's wrong on both sides. So yes, I have supported the Iron Dome, which protects the Israel brothers and sisters from terrorist attack. But I have also been very vocal, as I have with Mr. Khalil, that this issue of attacking people because of what they look like or how they pray. Listen, I'm a black man in America. I know a little bit about discrimination. I don't stand for it. I don't support it. But I also don't run from our allies.
So, Congressman, the second kind of bigger group is, it seems like there's a lot of questions here where everyone just knows what to do, wants to know what to do and how to help. And I know you've spoken to it throughout.
I think we've kind of gone through that throughout the whole meeting. Wait, we haven't what? I'm sorry? Well, wait a second. Hold on. Wait, what? Listen, wait. Well, and wait, guys, I'm happy to hear everybody, but we all can't talk at the same time, please. I will get to you. May I just respectfully, we cannot do it this way. Raise your hand and a mic will come to you. It is not going to work if we just start all talking at the same time. So you did, and I'm going to respond to you. And here's the reality. I said, and I will say it again, I wish I had an antidote for all that cures us in this evil regime that we're working with. The reality is this. We are going to continue to do everything we can within our congressional powers. We are going to continue. We have some 100 plus lawsuits in local and district and federal courts that are being heard, many of which we're winning. There is no easy answer to say this is what we're going to do other than what we're doing. We're going to continue to come to you. We're going to keep, yes, everybody's got their hands up. We're coming. We're going to continue to come to you, and we're going to continue to be honest and forthright. I, unlike some members, I'm not running from these tough questions. I'm inviting them. I've invited you because I want you to see, here's what we're doing. But I'm not going to lie to you and tell you that it's going to be easy. And I'm not going to tell you that we can summarily and singularly fix this, because we cannot. But we can continue to band together, to organize, to invite you to reach out. You've asked what you can do. I've said it multiple times. I'll say it again. Please show up at these other members' offices. Write them letters. Make phone calls. Respectfully challenge them on their positions. Organize within yourself. And oh, did I say at the core of all this? We got to vote. We got to vote. Because if we had turned out and voted the way we're supposed to, there would be no Project 2025. There would be no Donald Trump. There would be no Elon Musk, whatever. So at the end of the day, we are not without power. But I'm not saying we're going to wait until the next election, because we got to work now. And a part of that working now is to organize within your church groups, organize within your neighborhood groups, organize within your fraternities, sororities, within your bridge clubs, within any association you have, and speak out. Speak out. And don't give the other side a pass. Who's next, Trace?
Hi, I'm Karen DeOr, and I'm from Algiers Point. Woohoo!
Right.
I just want to let everyone know who does want to do everything, and I think everything that Congressman said is really helpful to make those calls and do the social media. But there is going to be a really great coordinated protest on April 5th at Lafayette Square. I know there's Indivisible people here. It's put together by Indivisible, by the Women's March, by 50501, by a lot of really great progressive groups. You don't have to sign up for anything. It's 2 o'clock. Congressman and everyone here is absolutely invited.
Thank you, ma'am.
That's
Thank you.
it to do.
Trace, and then right here up front.
I was going to get this young lady.
Okay, and can you come over here, Selton? You can catch him next.
I just wanted to follow up. First of all, thank you for having this town hall. So I know we have like a lot of money in the Democratic Party chest at the federal level. What is being done to distribute those to local groups, people like Indivisible, that are doing this on a shoestring budget? A lot of these people are mothers, they're busy. It's a lot of ladies, honestly. And like they need the support. So what are we gonna do to support them? And second of all, what are we gonna do to coordinate? If things get really bad, we're gonna need work stoppages, a general strike. Are we gonna coordinate with unions who are supposed to support the Democratic Party? Are we gonna like coordinate with them, give them funds, give them resources? And finally, kind of a third prong is there are people who have been going, like Bernie Sanders has been doing this anti-oligarchy tour. I know not everyone likes him, but I think what he's doing by going to the red districts is so important. Are we gonna replicate that at the state level? So those three things, yeah.
So the answer is yes, we should. We absolutely should go into those red districts. We should not give them a pass. We should be on their doorstep. I cannot underscore enough that it should be done peacefully and respectfully, but you should speak your mind. Do so in a respectful way and have people understand that we're not going to simply go away. We're not going to go away. We're going to continue to work with our unions. We're going to continue to work with organizations. I wish your earlier statement was correct, that the Democratic Party had an unlimited amount of money. They just don't. But what we do have, and what they do have, because it ain't mine, what they do have, there are programs to assist with local organizing. With all due respect, I don't know how you quantify a lot of money. Certainly not as much money as is needed to run a government in the face of what is attempted. I'm not here to defend the Democratic Party. I don't know how much money they have, but I will tell you that they do use resources throughout the country to assist in efforts like this. As to how much or how many, I'm happy to put you in touch and get you information to answer those questions for you, though.
What about text banking operations?
What's that now?
Like text banking operations, we were always getting texts during elections about donating to the Democrats. Why is that not being deployed right now to educate them?
Yeah, and we're not gonna, because we've got other people, but I'll answer that. She said, what about text messaging? And while you may not have gotten it, there are members, I have personally done text messaging in this community. You don't get every single person. Sometimes the system is random, but we will continue to step up that game, not only through the Democratic Party, but also through separate individual apparatus, the Louisiana State Party, the National Party, and many others, to make sure that people are aware that these activities and resources, however scarce, are available. Yes, ma'am. I think this gentleman right here.
Hi, thank you for having this. I understand that we are not in the majority, and I understand that we have to get out there and do the things you're asking us to do, and I'm doing those things.
Thank you.
The concern that I have is, yes, we're winning cases, but we are in a, as you said earlier, a constitutional crisis. And we have a president who is not being checked by the equal parts of government anymore. He has basically decided that he won't listen to it. So our hands are a little bit tied there, and I am concerned that, not necessarily with you, sir, but with our country as a whole, that the urgency that needs to be there isn't there. The time has run out. We have no more time. And programs that really benefit everybody in this room and all across the country is being cut every single day and are trying to be cut. So what, and I understand what you said we can do, but what, you know, I know we're gonna do protests and I'm all about that, but from an organizational standpoint, it does seem a little bit scattered, and I don't know what else besides the things that you said. Those things, we can win cases every day, but if he's not going to be held accountable, what does that matter?
And sir, trust me when I tell you, the constitutional crisis that we find ourselves in, as a member of Congress who represent 1/3 of the checks and balances for our country, the framers of the Constitution set forth these checks and balances for a day such as this. But it appears to be failing because this president brags about having control of the Supreme Court. A Supreme Court that is, in its very design, supposed to be independent, colorblind, and above any politics or partisan action. But we know that doesn't appear to be true. So we will continue to push and fight. And as much as I wish, my brother, I can tell you, I got this ace in my back pocket, and I'm going to wave it and make it all go away. Anybody who tells you that, just lying to you. I'm not that guy. I'm here to tell you that I'm going to give you every fiber of my being. And I'm inviting you to be a part of the process. But if anyone came here to get an answer that said that you can leave here today and say, this is going to fix it all, I'm sorry. I hope I didn't disappoint you, because that answer, honestly, doesn't exist. What does exist is our ability to band together as we have as a people throughout our nation's history, to band against tyranny, to band against racism, to band against xenophobic behavior, to band against hatred of every type, size, and place. That is the moment we're in today. This is our modern day civil rights moment. Let the question be asked and answered affirmatively. Where were you and what did you do? And I suggest we are here, we're present, and we ain't going nowhere. And we're going to fight it with every fiber of who we are.
Hi, Congressman Corder. Thank you so much for doing this town hall. I really appreciate it. Before I ask my general question, NPR reported this morning at 5 a.m. Eastern Time that segregated facilities are no longer explicitly banned in federal contracts. I know that doesn't have anything to do with Medicaid or Medicare, but
it does speak to the fact that we have a very challenging time. And every day that we pick up the news, we find out yet another horrible thing that's been done. Like to go to Arlington Cemetery and remove any reference to African American, Asian, or Hispanic, or women who died with valor, and to remove any reference to their existence is sick.
Well, this rampant dehumanization of people in our country, and I mean, with all due respect to our panelists and stuff like that, we all know the answer to why they want to get rid of Medicaid and Medicare. They want people to die. And we're not being honest about that. And we're not being honest about what they really want to happen. Now, I've actually worked and volunteered in politics since I was 12. So I feel like I have a little bit of a different perspective on this, but I feel like no one's ever asking the question why they're going after these certain things and where they got that idea. And that's something that I think is really, really important.
Well,
who gave them that idea?
I will tell you that every one of the questions you posed, with the exception of who gave them the idea, has been answered tonight. We said that their intent is to rob the poor to give tax breaks to the rich. We said that this notion of the Etch-a-Sketch, where we are literally killing people, is unconscionable, but that is the net effect. Our professional said it, I've said it, and respectfully, ma'am, we get it. I don't think anybody on this stage lied to you or anybody else. I
don't think anybody is lying. I think
did.
that there's a lot of speaking in platitudes to try to soften the blow of some of this information.
How could I say this any more plain? This is unconstitutional. It's illegal. It's hateful. It's going to kill people. It's going to be the demise of our country. It's going to undermine the checks and balances of our Constitution. It is evil. It's hateful. It's racist. If I missed an adjective, I'm happy to give it to you. The point I'm saying, ma'am, is we are on the same team. But there are no quick answers to these problems. None of these experts, by the way, who are all on their own free time, who gave of their time from their families to be here, I want to double down on the fact that they've not lied to anybody. They've been very honest and forthright with their answers.
And I just want to
say one thing really quickly that I do think is an important opportunity, is that we are not doing as good of a job as Democrats communicating. And what's happening is we've got a lot of hysteria and confusion, because the New York Times says one thing, the Wall Street Journal says another, and I think the public is confused about what's happening. So I do think...
That's why town halls like this...
That's why this. So I think the more we can have this, and the more we can have very, very simple messaging about... And by the way, who's going to get most impacted by these issues? It's going to be people who voted for Trump. That is... And we've got to get that message to them.
While the mic is being handed off, I just want to say that we've dedicated decades of our professional experience. You know why? Because we care. So despite the root cause of what their intent may be, we're going to be waking up tomorrow, going back to work for you, so that we can make sure that your health care remains intact despite $880 billion. So we will be here.
Yes.
Thank you. I want to thank you again, Congressman, for pulling this together, because I think it's so important, and I have enjoyed listening to everyone's comments. One of the things that resonate with me, and I'm probably sure it resonates with all of you in the room as well, and I promise I'm going to get to my question, is that it is a scary time. I worry about something happening globally, and we're not prepared because we're being isolated. The things that he's requesting and things that's in motion is just so damn scary. But I want to go back to what happened between the House and the Senate. It does not appear, to your point, it does not appear as though we're as coordinated and in sync as we need to be. Yes, these town hall meetings are critical, because I think all of us has a vested interest in wanting to do the right thing to get us out of this mess. But how do we ensure that leadership is putting forth the same, what's the word I'm looking for? Alignment.
Message. Yeah.
So that the rest of the country won't, or the rest of us won't feel like we're not walking together, because we are, but we're not necessarily seeing it. I know what you mean. I have other congressional members that I'm dearly friends with. I've seen them stand up. I know what you guys are doing, but it's not coming across as succinct as we'd like it to be.
And I agree. And That's why every piece of advice is being taken as constructive criticism about how we can do it better. Clearly, we aren't doing the best job. We can do better. And so these town halls are data collecting opportunities so we can hear from you, take it back, and figure out how we can do a better job at messaging, how we can do a better job at action, how we can do a better job at motivating people to vote. Because at the core of it all is, my mother always said, when you point, one finger, you got 5 coming back at you. We all have a responsibility to vote, to get out, register, and vote, because in this system of government, voting, you want to know what we have? We have the ability to choose our leaders. But when we stay home, we just elected the worst person on the ballot. So we will take everything that you're saying and we will digest and distill it and try to do better. Take this back to the National Party. Take this back to our leadership. These are not just exercises in futility. We're really listening. We're recording. We're taking notes. And we're going to use everything that's been said today to build a better mousetrap to better represent you. And we're coming close to our time, so I got a couple of questions, a little bit over time actually, and I promise, but I'm going to try and get to the last few people before we time out. Yes, sir. Could everyone be very brief in your comments so we can get to the last few people? Yes, sir.
I'll do my best, Congressman. Thank you for your invitation. This is my first time. I'm not a doctor, not an attorney, not a politician. I'm an industrial engineer. I've worked for the Fuji Water for 27 years and 8 years at a nuclear plant. The worst event of my life took place in 2021. What I call, after nights of staying up to see what's going on, no disrespect to the medical professions, what I call a deliberate indifference. My wife, Eunice, died in 2021, November the 8th, 13 days. She died like a prophet. Not an ice was given to her. The infectious disease doctor said they called him too late. The ambulance came 4 hours to carry her 1/10 of a mile to ICU. The ICU was not staffed with the urgent care doctor. One of the providers, I went through records and records on my knees crying because she was the only hope I had in life for 47 years that falsified his classification as an MD. Not a federal, not a state. State LDH tried to get a restraining order on me because I'm a vocal person. And all these faults, all these nightmares happened to her and she was trying to help everybody. So what I call John Gotti's in white coat. Because there is a 6th profiling of a civil right. I discovered that. The patient's value. This patient, Eunice, the value of her income to these doctors were going down. So they deliberately,
sir,
they deliberately just.
We've got staff here.
So NIH, by cutting NIH's funding, my hope is going to be for other ones to save their life, to be also have a likelihood in the future.
Yes.
Because not all doctors are bad, but some of them are in the wrong profession.
Thank you. And I did a whole panel discussion a week and a half ago with doctors from Tulane, LSU, and the Bio Innovation Center to talk about the drastic cuts to the National Institute of Health, NIH dollars that are being cut, which are criminal, because these scientists do nothing but research for cures of these dreaded diseases. Why would you want to stop that? And someone said earlier, are you trying to kill us? And at some point the answer becomes, it certainly appears that you are. Right behind you, Trace, and then this gentleman here, and this lady, and we've got to stop. Yes.
Thank you for your time.
Oh, I'm sorry. This one and then that one. I'm sorry.
Thank you for your time. I work in international public health, where I got laid off because of the cuts to USAID, and we are already seeing catastrophic consequences from that in only a month of those cuts. And I appreciate your speaking out, and I appreciate that you keep saying we're going to keep fighting, but there have been numerous levers that the Democratic Party has not utilized. We continuously approved all of his nominees, like RFK Jr. and all of these other clowns.
Respectfully, there was one lever that we didn't do, and that was to stop cloture. The others, as
I was about to get to that one, too, yes.
But as it relates to his appointments, the House doesn't have votes on that, only the Senate. Every Democratic member voted against his appointments. These have been Republicans who control the Senate. That's who approves appointments for secretaries. As it relates to Chuck Schumer's ill-fated move, which I could not agree with you more, was the lever that Democrats had and Chuck Schumer did not use.
Right, and that's a catastrophe, and I appreciate that the Democratic Party, and particularly Congress, you have very, very limited opportunities, but you keep saying you're going to do everything in your power, and I think that some of us are feeling very panicked because things are happening so fast, and the consequences are imminent, if not already passing. So could you speak to other specific levers or milestones? I appreciate the sentiment that you're going to keep fighting, but as you said, we cannot wait until 2026. So what specifically are you and the congressional Democrats, what specifically can you do, will you do? Because I call my representatives every day and I want to continue to hold them
Please
accountable.
Do. Thank you. So, Trace, get the mic. We got to keep it moving, guys. I want to get everybody, so we can't have dissertations. So, ma'am, I appreciate what you said, and you're absolutely correct. And I can't give you a different answer than what I've given. Specifically, what we can do is we can continue to use our voices in Congress because we don't have the parliamentary votes to block a vote. We continue to use our procedural tools to slow them down because we don't have mathematically the votes to block bad legislation. We don't have the constitutional right to do anything above when we vote. Now, what we can do is to use every tool that we have in Congress to hold hearings where possible, to call them out on the House floor where possible, to come to town hall meetings where possible, to talk to the media where possible, to continue to engage and call them out publicly for what they're doing. In many ways, we become like citizens, although citizens on steroids. The Constitution only gives us, and that's why I said everything within our power. I'm just not going to lie to you and tell you we have power to do what we can't do. Our will is our strength, and our ability to fight is our gift. We are going to utilize both, but we need your help. We need people to come together and to fight with us. The levers that we have is that we show up and we call them out. But just like in any election, when it's time to vote, those with the most votes win the day. And in the case of policy that requires congressional action, majority rules. We don't have the majority. But that's not an excuse or I wouldn't be here. I'm telling you, notwithstanding those obstacles, we're showing up. We're in their faces. And we're trying our best, as I'm asking you to do the same, is to encourage them to do the right thing, to shame them into doing the right thing, to hit them with the facts. And then when we've exhausted what we can do procedurally in Congress, simultaneously we're taking them to court. And we're challenging them on things that are unconstitutional, illegal, and outright wrong. But even if you've seen the news, President Trump and his people are saying, we aren't listening to the judges. Therein lies the therein lies the constitutional crises. I don't know the answer to that yet, ma'am. The danger is we've never had this. So who controls it? You say call the police. That's right. So this crisis that we're facing, trust me, you think you're frustrated, and I feel you are, and you have every right and desire to be. Trust me, I wish I had a hammer that I can take to this chainsaw. I wish I could hold up and say, this is the United States Constitution. Damn it, listen to it. But when you got somebody that, I can do it, yeah, and I do it every day. But you're asking me what we're doing and what we're going to do to stop it. And we've got to move from telling people what they want to hear, which Troy Carter's never going to do. I'm going to always tell you the truth, and I'm going to give you 100% of everything I have to solve the problem and not just get away with answering a question that makes you feel good. We got a lot of work to do, and we are in crises. Yes, ma'am.
Thank you very much, Congressman Carter. I've never spoken in public, but I'm going to make this quick. I do think you have an ace in your pocket that you're not utilizing, and that's the people. You have your constituents here. We're all feeling helpless. We're all feeling like we want to do something. And it's time that you
the constituents who are incredibly loyal to you to mobilize us. So I just wanted to point that out, that you have more than just Congress, the courts, you have your constituents, and there's ways of mobilizing and utilizing us for the best interest. And also, whether your constituents are Republicans or Democrats, more Republicans are going to be harmed from all the harm that's happening right now. So it's going to cross over. So you have an opportunity. So I just wanted to share that with you.
And that was a perfect recitation of everything I've said tonight. That C is constituents. That C is community. That's why we're here. And so we are talking about what we can do together. And if you call it an ace in the pocket, great. We'll call it that. And I believe you're powerful. That's why I'm asking you to join in the effort. Yeah, yes, ma'am. Quickly.
I just wanted to say that I think you could probably use some of the members in your office to help mobilize us.
Ma'am, that's what my staff is here tonight. My staff, I get it. And I'm not, it appears that you want to be argumentative, but I'm not going to let it be, because we are here to demonstrate that's what we're doing. That's why we're here. And we hear you, and we will endeavor to do even better and to be more engaging. But remember, the reason we've called you here tonight is to inform and ignite. To inform. I said I wasn't being argumentative. I'm talking about me, sir. I said I was not being argumentative, not her. I get it, but let's stay with I get it. I was saying I was not. I feel your passion. We're on the same page. I'm not. Ma'am. Ma'am, I was in Chuck Schumer's face like I'm right here. He's a grown man. I can't make him do it, although I hate what he did. Yes. Yeah. We're ignoring one of the biggest parts of the action item, and the biggest part of the action item, as she just mentioned, is our ability to mobilize and vote. And we all have to do that. We all have that role. Yes, sir. Yes, ma'am.
Hi. To take it back to Medicaid for a second, given these massive cuts, what role do you see state Medicaid managed care organization contracting playing in potentially filling some of those gaps? And yeah, this might be a question for the former secretary. And how can the public engage in that to ensure that MCOs are prioritizing community health over corporate profits for the sake of our most vulnerable community members?
Yeah. Well, this is easy. So Medicaid is almost $1 trillion industry. It's almost as big as Medicare now. These companies are making gobs of money, billions of dollars on Louisiana, for example. And where are they? Where are the national CEOs? Where are they speaking out about Medicaid? I think that's important. They do have an important role. I do want to mention that the recent budget did not have Medicaid cuts, so I do think we reinforce with our leaders and representatives, keep it that way. Make sure that you say that. I think in terms of community benefit, I mean, our nonprofit hospitals ought to be doing community benefit like they say they're doing, so that because they don't pay taxes, they ought to do it. And as states, we can hold them accountable by requiring them to do certain things for community benefit. I think that's a great opportunity. And then finally, I think that there are a lot of things that states can do to support Medicaid, right? And so that's something where I'd like to see our state. I want to just mention really quickly Dr. Avegno, who's one of my heroes, because she's really, in the face of lack of vaccine, positive communication, and all of this other stuff, she has stood up personally and said, I believe in this, and we support it. New Orleans supports it. So New Orleans, too, through Dr. Avegno's voice, can be a powerful advocate for the kind of change we want to see.
Thank you.
I've been listening to everything, and like you said, we only need 3 from the other side to get some things done. The Republicans had the mega people. They had their Project 25, their manifesto, and they're sticking to it with guns. And because we don't like it, we've got to the opposite side. So we're as far left as they are far right. Perhaps it's time for us to write a manifesto for a third party. And that manifesto would be the compromise that all of us could rally around and try to get the few from the other side and the few from our side to come together for what our Constitution does exactly right now. But right now, that bad vote that took place the last election has given all the power to one side.
Yes, sir.
So what we need is some compromise right now to get a bunch in the middle that can agree that this nation is going in the wrong direction. But as long as we stay on opposite sides like that, we're not going to get anywhere. We're looking for direction right now as to where do we go? How can we help? We've written letters before. Before this election, people didn't vote even though we were telling them to vote. We were telling them how dangerous it is. So we need something drastic right now. We need something like a third-party thing to say, okay, we on the left are going to give up something to compromise a little bit with the people on the right. And some of those guys on the right know that this is going to hurt them too.
Absolutely.
Absolutely. But they won't give up right now because we're too busy fighting.
And that's why we have to continue. You're right.
Yeah.
That's why we can't give them a pass.
Right. But
We
that
have to
manifesto right now is what's necessary for us so that we know what to do. You know, if we want anti-corruption, and it's in the manifesto. We want voting automatically when you're born, that's in the manifesto. All of the things that we can agree on, put it in that manifesto, and you talk to the other side and say, if you don't like this, what do you like?
Right. Thank you, sir. And I want to make sure we've got a couple more questions I want to get to before I have exceeded our time with you and our panelists. And I thank you from the bottom of my heart for all of your comments. I know it isn't easy. I know we're all passionate about where we are, and I wish there were an easy answer. Together we're going to get there, though. Ma'am, and then we'll go to the rear, and then we've got to shut it down.
I want everybody to follow the civic rules and the judicial rules that Congressman Carter is giving us, but we're forgetting that we can vote with our dollars. We can be very specific about where we spend money because that is what a lot of these people understand. They don't care about us as individuals, but they want us buying their stuff.
Yes.
So please consider, you know who owns which of these big businesses and where they are and what they do. You don't have to shop there because they're depending on your dollars.
Thank you. To the rear, and then we're going to have to, this will be our last question. I'm happy to answer the individual questions as we exit, but I've got to be true to, one, getting out of this building as we promised we would be, but more importantly, letting our panelists go and getting you back to supper.
Yes, sir. Congressman, I don't have a question. I just have a comment. I certainly, like a lot of individuals in this room, want to thank you all, you and your panel, your expert panel, for taking the time to come, giving of yourself to explain to us exactly what's going on. I know this is not an easy job you have. We appreciate your commitment, your passion, your dedication to make sure people's lives are handled properly. You have an expert panel that does this every single day. So certainly, I know this thing got a little rowdy for a minute, but certainly everybody loves you for what you're doing. We really appreciate it. So thank all of y'all.
Thank you very much, and thank you. Thank you, and thank you all for being here. Thank you for your comments. Every single one has value. Every single one will be taken seriously. This will be an ongoing process that we will have to fight for the American people. There's no easy answer. But again, we're not going to quit. We're not going to run. We don't know which tools we'll use next, but we're going to use tools that we didn't even know we had. And it depends on us all standing. Yes. And to continue to fight for the people of America. Remember, we in this room are not the enemy. The enemy are the people who are trying to cut, divide, and conquer. Let's use our energy in the most effective way to push back against tyranny, hate, and discrimination, to push back against those that would rather see us fight against each other instead of find solutions to the problem. There is no easy answer. I've heard you. I've taken good notes. I promise to take every comment that was made as constructive criticism, and I believe as we started this meeting, we ended on the same page that we want what's right and fair for the American people. God bless you, and thank you all for being here. For those who live in the area, there's going to be an election that's coming up, and there's some modifications to your voting, for your voting booths. We have the Chief Election Officer of the Parish of Orleans. I'd ask you guys just for 1 second, give me your attention so he can give you some very important information as to where you can vote.
Thank you, Congressman. Thank you, Congressman. Real quick, we have a polling place change for this area. As a matter of fact, right down the street, with the help of Councilman Green, who helped us with this move. It's the emergency move from the library right down the street to Dillard University at Kearney Hall. So we need to make a note of that. We're going to make a public announcement. We also have one other move that we're inking right now, so we want to make y'all aware of that. So one more thing. I need to ask a favor, everyone, before you leave. I need you to repeat after me. Ready? Elections have consequences. Elections have what? Now, when you call your family and friends, make that message known. Elections have consequences. Thank you.